go.
Hi, I'm Joshua Pangan. I'm a third-year nursing student, and today I'm going to be demonstrating the administration of a medication through CIVA pump. I'm going to start with hand hygiene first, and I'm going to a little bit background information on my patient. This is Emma Wrightson, and she has come in for her pneumonia. She has no known allergies, so her first medication up is cloxacillin, and I have already compared my MAR to my physician's order, and I know that it is correct. So I'm going to go. I grabbed my vial medication, ensuring that the expiration date is good and that there's no damage to the vial. So I'm going to go ahead and do my first medication check. So right patient is Emma Wrightson. Medication is cloxacillin. Right dosage is 1 gram, and this is a 2-gram vial, so I know that I can achieve it. The right route is IV, and this is for IV infusion only, and right time and frequency is every 4 hours, and I know that this is her first dose, so the right time is now. So I've done my first medication check. I'm going to go ahead and flip to my CIVA chart, my PDM of cloxacillin. And here it says cloxacillin, and this is an antibiotic. And now this is appropriate for my patient because she does have an infection, so this is going to help it. As a student nurse, I am able to give this as it says that I can. The usual dosage is 1 to 2 grams IV every 4 to 6 hours, so I know the ordered dose of 1 gram IV every 4 hours is appropriate. Now for reconstitution-wise, for a 2-gram vial, I have to add 6.8 milliliters of sterile water for injection for a final concentration of 250 milligrams. So here I have my sterile water. I'm going to take the lid off there, and I'm going to go and alcohol swab these for 30 seconds and let it dry for 15. 30 seconds, let it dry for 15. I'm going to grab my 10 milliliter syringe here and my blunt fill needle, and I'm gonna get 6.8 milliliters of air, and I'm gonna inject this into my sterile water.
And before I do my dilution, I'll do my second check. So I draw dilution, right drug.
So I'm gonna go ahead and give those a good tap to get rid of any air bubbles.
650 milligrams.
So 6.8 milliliters of sterile water, and I'm going to head and inject that into my cloxacillin vial. And make sure that the plunger goes up again so that air does not accumulate into my vial. And I'm going to cap this to make it sterile, and I'm going to go roll this in my hands gently so that there's no air bubbles can accumulate into my medication. So looking back at the final concentration, I did my calculations prior, so I know that with 250 milligrams of final concentration, I need 4 milliliters of this medication. So I'm going to go ahead and wipe my vial again in case I touched it for 30 seconds and let it dry for 15. I'm going to recalibrate to 4 milliliters, and I'm going to inject this into my vial and retrieve it. I'm going to cap it again just to ensure that it's being sterile. I'm going to get rid of any air bubbles. And doing this over a sink or anything, I'm going to go ahead and recalibrate it to 4 milliliters. And I have 4 milliliters here. No air bubbles. So before I further dilute it, I'm going to compare my injection and vial, my syringe vial to my MAR. So right patient is Emma Wrightson. Right medication is cloxacillin. Right dosage is 1 gram, and this is my 2-gram vial. And calculated, I need 4 milliliters, so I have here 4 milliliters. And right route is IV, and this is for IV infusion only. And the right time and frequency is every 4 hours, and I'm going to be giving it now. So flipping to my CIVA chart, I'm gonna look at the cloxacillin. So for the 1 gram dose, I need 50 milliliters in a 60 milliliter syringe. So I've done my calculations prior, and I need, for 50 milliliters of total volume minus my 4 milliliters of medication, I would need 46 milliliters of normal saline. So I have my normal saline back here, and I note that it is not expired and that it is not damaged, so I am able to use this. I'm going to go ahead and alcohol swab the injection port for 30 seconds and let it dry for 15. And I'm gonna get my 60 milliliter syringe and my blunt fill needle. I'm going to get that. I'm gonna obtain my 46 milliliters of normal saline.
My mini bag without breaking sterility. And close the, and sorry, I need to close the roller clamp beforehand so I don't break, so I don't lose any medication. I'll post swap the port.
So I'm gonna go connect this again and ensure that all the air bubbles are gone. And I'm gonna go and recalibrate this to 46 milliliters. Get rid of any air bubbles. And I have my 46 milliliters. It'd be less messy. I'm gonna go pull back so all my medication can be instilled. And with sterile technique, I'm going to input my medication. And I'm gonna put these in the sharps container. And I'm going to recalibrate it so we can hit 50. And I'm gonna go grab my blue cap to make sure that it remains sterile. Beforehand, get rid of any air bubbles. Now I have a medication here, label, and it says the patient's name, the type of drug, and the amount of dosage I need, with most of the time and my signature. So I'm gonna go and grab my MAR, my alcohol swab, and I'm gonna grab my microtubing set. And I'm gonna go ahead and enter the patient's room. Hi, Mrs. Wrightson. I'm gonna do my hand hygiene. I'm doing a safety check too, ensuring that she is fine and that she is okay and that there's no hazard. I'm Joshua. I'm gonna be your student nurse today. I have a few medications to give you, actually just one. But first, I'm just going to check your armband. Can you please state your name for me? Emma Wrightson, VIN number 123 123 456 456 789 789. Do you have any allergies, Mrs. Wrightson? No known allergies. Perfect. That's on your mark. So while I'm here, I'm going to go assess her IV site, making sure that there's no infiltration, infection, or phlebitis, that it is good. Her primary line is running properly, and that it is at the safe rate, and that the right bag is hung. So, Miss Wrightson, I have your medication for you here, so I'm just going to go ahead and do my third check. So, right patient is Emma Wrightson. Right medication is cloxacillin, and here I have cloxacillin. Right dosage is 1 gram, and this is 1 gram. And right route is IV, and this is for IV infusion via CIVA. And this is right time and frequency is every 4 hours, and I have here every 4 hours, which is gonna be now. So, Mrs. Wrightson, this is your cloxacillin, and this is for your infection, for your pneumonia. I know this is your first time getting it, so if you feel any of the symptoms like nausea, vomiting, and diarrhea, I'm gonna put your call barrel near you so you can call me and I can go ahead and look after you. Now, the patient does have a right to refuse, but since she didn't, I'm gonna go ahead and start my administration of it. So here I have my microtubing. I'm gonna ensure that my line is straight and not tangled, like it is. Okay, that my line is straight and not tangled. I'm gonna look for the port that's able to connect to here. And I'm gonna ensure that my web is there.
Well, like I said, I'm dealing with.
And I'm gonna go ahead and connect it. And now I'm gonna go forward prime my tubing, ensuring not to touch it. And there I see the bleb. And now I'm gonna go connect it again. I'm gonna grab my CIVA pump and attach my So there's my CIVA pump. I'm gonna post it, and I'm gonna put it down. Ensure that it's for 39 minutes here, as my CIVA chart says, to instill it for normal and 39. And I'm gonna grab my alcohol swab here, and I'm gonna connect it to the first port because she does not have any push medication. So I'm gonna go ahead and put it to the port closest to her, and I'm gonna swab it for 30 seconds, let it dry for 15. 30 seconds, let it dry for 15, and I'm gonna go ahead and connect it. 30 seconds for 15. And I'm gonna go ahead and press the normal, start normal, and it's at 39 minutes, and I'm gonna ensure it's running. Since this is Mrs. Wrightson's first time receiving this medication, I'm gonna stay with her for 5 minutes in case she experiences any adverse effects of it. And I'm gonna go and document my administration here, that I've documented it. I'm gonna do an exit safety check and ensure that she is fine, and then I'm gonna come back with a 3 cc normal saline flush and make sure that it starts at normal as well, and it goes down the same way that the same time that this medication went through. And this is for critical thinking. This is just to ensure that all the medication has been flushed into her line. And I've done my exit safety check, so